It'll be in that blue wrap. So I know it's kind of weird just opening that up normally, but yes. Sorry. Yeah. Wait. Sweet. Thank you, Heather. So this probe will just sit right here and plugs in over here. Luckily, everything that plugs in only goes in one spot, so it's not. It'll be easy to not. You won't be able to mess it up. That one checks off trust. So this is what you'd be able to set up like automatically when you're in the room before anything gets opened up sterile. And then when we go sterile, we have two. We have two disposable pieces. I have a demo. That will come in like an actual box. And we would use a mayo stand. So a mayo stand cover will be needed for this. But this is what the disposable handpiece looks like. So, I have a little table here. But we can, but these are the components that will check off everything else. Essentially. So, can I get, how many, oh yeah, by the way, how many are nurses and then scrub tech? Okay, great. And you guys are in usually in all these urology cases? Okay, cool. Well, okay, if I can get two of you guys, one nurse, maybe one for the practice. Okay. Sorry, so, this will be one component. Alright, cool. Yep. So, the arrow end always goes to whoever's non-sterile. So, so she'll open it up and you the arrow and then that white piece as well. So you can go ahead and connect that. It doesn't matter what order you plug in it up. Okay. So this goes in right here. It's like a puzzle piece. Yep. That feeds through here. Just close it. We will need a suction canister. We'll just drop it in. Yeah. Your end will connect to this right here. And then the next thing you will hand off is this cord. And this just plugs in right here. That may or may not have lost its
Is that like magnetic
battery.
or something?
No, it just goes in. It doesn't matter what side you put it in. Yep, like that. There we go. That's cystoscope. So that's just the cystolite right there. And then the last piece, two pieces that will be handed off are these two. This, you can plug it right there. That just plugs in right here. Oh, it's good. Sorry. Sorry. It was like pushed all the way in like this. And it usually won't latch if it's in that position. I just pulled it out a few Sorry. I just pulled it out like right at the edge of it, pretty much, as long as it's together. Here you go. You just plug this in right all the way in, and then you push that out. Cool. And this will connect to a 3,000 saline bag that we need.
It's leftovers.
It's a normal water, I promise. Foot pedals in the back, sorry, that's X'd off. I'm gonna go ahead and plug it in right now. Once this is plugged in, this is the only connection that's in the back. Once it's plugged in, you can always leave it plugged in the back. So, but just so you guys know, so red dot up, and then there's just a little option back here. Let's foot pedal. Cool. So then the last things we need are handpiece and priming. So for handpiece, you will take one of these. Let me see if I have a trade. Yeah. So one of these. So in our disposable, so our two disposables, in our disposable drape pack, so we have that as one disposable in the white box. In the drape pack, there are drapes that are the patient drape, which has the leggings. Then there's going to be 3 of these. We'll use one of these to drape this arm. This is holding the ultrasound probe, so because it's non-sterile, we can just drape this non-sterile just to keep it clean. And then the second one will be used for that arm, which you will drape sterile right before the case. And then this third one we'll use to drape this motor pack. So you'll have this on your back table, and what you'll do is you'll stretch, you see that hole? You'll stretch that hole open. Yeah.
Okay.
Probably like that. And then you'll take it out, and then you'll just hold it open like this, and you will just drop it through there. And when it hits the bottom, you'll grab it, and then you'll pull that drape and drape the top of it. You'll ideally be over here, so you can here I'll show you. You can just when you drape it all the way through, you won't touch that door. You'll just hang it over here. And then you'll just feed, now you'll pull and feed this whole top lip to where it shows. Because you're gonna lower like this whole top piece, yeah. Because you're gonna connect that to that. You want it to where that silver button shows, so that's perfect. And now you will just gold cord down, and then it's kind of finicky as a demo at this point, but you'll push them together. Yeah, it might be in a little bit, but there you go, just like that. So, that's everything. So, and then the last thing you'll do, if we were connected to a bag, you would hold down this prime button and it would prime. So that's the entire setup. Oh, that attaches to the side there. That is a general overview of everything on the setup. Do y'all have any questions?
I do. So, if we're using it on a regular bed?
We will still need stirrups.
Right. Well, and that's what I'm saying. What is the benefit of doing it on the bed versus the?
Yeah, I would say the only thing is the beds that have the cutout, we just so the blood can hang off, yeah, because it's going to the rectum. That's honestly probably the only
Okay.
point. Some, honestly, this, like, some beds in the past don't allow our arms to move, but this is perfectly fine on this level.
Okay.
This is, no issue. The only thing is if we had to, cut out, that's the only preference.
Okay.
And, yeah, okay, so that's everything on the setup. Let me just give a quick overview of everything that you need, like, to pull. So, this, he will, in addition to all of this, he will also be using they will also be using a receptoscope with a loop, just like your chirp setup. So everything that needs to be pulled is everything for a chirp. Everyone uses a bipolar generally, right? Right. Okay, cool. So everything for a chirp setup, we will need 2 to 4 bags, or 4 to 5 bags total. 3,000 saline bags for each case. Your normal cysto tubing, like the Y tubing, ELIC, anything else. Mayo stand cover for this, stopcock, sounds, having sounds just readily available. Anything else you guys are thinking that y'all may or may not use? Do y'all use normal ELICs or do y'all use tubing? Either works. Cool.
So if you were setting up this morning, maybe we just push this in here, but is there a certain side that it works better on the system to be on versus Neptune's versus what would the ideal?
Honestly, it does depend on just what the room looks like, but we would prefer this machine be on the opposite side of where the patient comes in. But like given, like just looking at this room, this has a lot of room here, so this would work. We would just push it, you know. And honestly, like given this is like this is a good setup where the Neptune and that can be on that side and this can be on this side. That's totally fine. But usually, like if this was on the opposite side, maybe the Neptune would come on this side. That's just that's what we've seen works best. So when it comes to the actual case, he is this stepper. There's a little horseshoe under here, and we slide it over until this is flush with this. So we just feel it underneath. When it's flush, tighten it up. So when it comes to the case, Doc is going to put in the rectal probe and map out non-sterile. He's going to put in 60 cc's of KY. So we'll need a lot of KY for this case. That's another thing. KY, probably one large tube, and then we will need, do y'all have ultrasound packets, gel packets? 2 packets per case. The reason because I don't have any of this on me, but we have a probe cover that we just put the ultrasound gel and tape over, which we'll show you on the day of case. But 2 is like the perfect amount for the probe cover. So
tapes come with it, or should it be?
no, we'll need like just one of those, just a clear.
Stair strips or regular?
No, just regular tape as well. This tape is perfect, what we want. So he'll put in the ultrasound probe, map it out, and then as soon as he's done with that, then you will sterilely drape. So you'll drape this arm, drape